Hi, I'm Dr. Mark Rosenberg, and I'm here to talk to you about integrative cancer treatment. What is integrative cancer treatment, and why does it exist? Integrative cancer treatment means applying many different modalities, many different types of treatments to treat cancer. Why do we need to do that? Because conventional treatment for the advanced stage cancers really has not been very successful. If we look at the survival rate, or the 5-year survival rate for advanced stage solid tumors now compared to 50 years ago, unfortunately people really don't live significantly longer. There was a large study that did look at this, and it was published in the British Journal of Clinical Oncology. And unfortunately, for most of the solid tumors, patients didn't live any longer. When they did, when chemotherapy or conventional chemotherapy extended survival, it generally amounted to about 2 months. So that's why integrative cancer therapy exists. The reason being that the standard of care for advanced stage cancer is not acceptable. I'm the program director for the first and only existing Integrative Cancer Fellowship in the United States that is being taught around the country and around the world. And what I do in my own clinic in Boca Raton, Florida, is apply all those principles that we talk about in the fellowship. So when patients come to my office, they get treated with multiple modalities, multiple different nutraceuticals, multiple different drugs, all to accomplish one thing, and that is to take an acutely progressive terminal disease and turn it into a chronic disease that we can live with. So now that we've established that conventional cancer treatment is not very effective for advanced stage cancers, the question is, why? Why is it not effective? Well, we now know why conventional cancer treatment is not very effective for advanced stage cancer. And one of the reasons is cancer stem cells. We know that every cancer that we've identified is initiated and propagated by the cancer stem cells. Unfortunately, when we use conventional chemotherapy, we do not kill the cancer stem cells. Conversely, as we kill more and more of the daughter cells, it can eventually trigger the cancer stem cells to multiply and not only make more daughter cells that will be resistant to the last chemotherapy that was given, but it also makes more cancer stem cells. And the more cancer stem cells in the cancer, the more aggressive it is, and the more likely the patient is, unfortunately, to die from that disease. In addition, what we've learned is as we continue to use conventional chemotherapy, not only can we stimulate the production of more cancer stem cells, but we increase the production of more resistant cells. So I think at this point I want to reference a gentleman that I think has done some of the most profound research on cancer in the United States. And his name is Dr. Robert Gatenby, and he's at the Moffitt Cancer Center. And Dr. Gatenby is a radiation oncologist, but also a mathematical oncologist. And he develops mathematical models that describe tumor growth in response to cytotoxic chemotherapy. And what he has shown is that the more aggressive we are with conventional chemotherapy, the faster we create resistant cells, and unfortunately, the faster the patient dies. So when we first start treating an individual with chemotherapy, what we use, and this is the standard of care, we use maximum tolerated dose chemotherapy. When we use MTD chemotherapy, we kill almost all the sensitive cells, leaving only the resistant cells, that small portion of resistant cells behind. The patient feels better because the tumor burden has been decreased, the CAT scan looks better, the tumor markers are down. However, with time, those resistant cells will reproliferate the tumor. When they reproliferate the tumor and/or tumors, the new tumors will be 100% resistant to the last chemotherapy regimen. So what we have to do is now go to a new chemotherapy regimen. Now, assuming we do use the correct chemotherapy regimen, once again, we'll use maximum tolerated dose, and now maybe only 70% of the cells are sensitive and 30% are resistant. We use MTD chemotherapy, we kill almost all those 70% sensitive cells. The patient feels better, not as good as the last time, but they feel better, and the CAT scan shows a good response, not as good as the time before. Unfortunately, what will happen with time is those resistant cells, which once again have no competition because we killed the sensitive cells, will reproliferate the tumors. Now your new tumors are going to be resistant to the last 2 chemotherapy regimens. So you can see what is happening. As we keep going down the maximum tolerated dose chemotherapy pathways, we are causing accelerated Darwinian natural selection and evolution, creating the most resistant and aggressive cancer that cannot be treated with chemotherapy. Now, is there another way to do this? There is, and to quote Dr. Gatenby's work, as he mentions, to survive cancer, live with cancer. Treat it as a chronic disease. So his approach was to do this. Instead of using maximum tolerated dose chemotherapy, use a smaller amount and kill only a portion of the sensitive cells. And allow those sensitive cells the remaining sensitive cells to still compete with the resistant cells, so the resistant cells don't multiply uncontrolled. And after killing a portion of the sensitive cells, a time later, maybe a week or a month or a couple of months, when those sensitive cells grow back, treat them again. Instead of using MTD, use a small amount of chemotherapy on an as-needed basis to keep the tumor burden stable. And then, just like Dr. Gatenby did with his mice, it's possible to allow people to live with their disease, treating this as a chronic disease rather than acutely progressive terminal illness. And in fact, that is what I'm doing in my clinic. I use low-dose chemotherapy, sometimes on a metronomic basis where I'll do it regularly for a period of 10 weeks, but then typically patients get it on an as-needed basis. Now, along with this technique that I use in my practice, I use many other modalities. I use a modality called cancer pH manipulation therapy, and cancer pH manipulation therapy is a term that I coined, and what it essentially is feeding or taking advantage of glycolytic cancers, cancers that feed on sugar and make a lot of lactic acid. I use a combination of drugs or a cocktail that inhibits the cancer's ability to get rid of its own acid. So in addition to the low-dose chemotherapy and the cancer pH manipulation therapy, we use other techniques such as dietary changes like ketogenic diet. We use hyperbaric oxygen therapy, which oxygenates the tumor and decreases hypoxia-inducible factor 1 alpha, which decreases the glycolytic nature of the cancer. We use many different drugs, we use many different supplements. The key to treating advanced stage cancer is to use multiple modalities while not getting too aggressive and creating a very resistant cancer. This has been Dr. Mark Rosenberg talking about integrative cancer treatment. Thank you.